All right, you guys, hope you're all doing well. Let's talk about the chapter regarding the skeletal system and people who have issues with their skeletal system and how we need to address them as far as exercise. I'm going to go ahead and share my screen to the PowerPoint. All right, so as we know, and this is something that you need to know, is that the skeletal system is composed of bones, joints, cartilage, and ligaments. Those are the portions of the skeletal system. That is all that it is. What it does, it supports the body. It provides attachment points for muscles and tendons. Take away your skeletal system, you don't have any form whatsoever. You're unable to move. Also protects our internal organs. You think about our rib cage as an actual cage for our organs and protects those for the most part. There's a lever system that works as far as movement, and our skeletal system plays a big role in that. Our bones also serve as a calcium reservoir. Houses red bone marrow, our skeletal system does, and is the site of blood cell formation. A problem with the skeletal system, one that we'll talk about, is osteoporosis. What happens there is bone tissue, usually with age, deteriorates and starts to lose mass. There's about 10 million Americans estimated to be affected by osteoporosis, with 80% of those being women. Additional 34 million people have osteopenia, which is a situation where someone has lower than normal bone mass. It's not quite enough to be osteoporosis, but it is close. So it's less than the normal amount of bone mass, but not quite osteoporotic. So we've got 10 million plus 34 million who are nearly there. Osteoporosis can affect anyone, and one of the most common things that happen because of osteoporosis is hip fractures. You see that a lot in the elderly. With osteoporosis, you're going to lose bone mass in both your compact and your spongy bone, which gives you bones that are more prone to fracture. They're porous, they're more brittle, and it can also, your osteoporosis symptoms aren't just confined to the bones in your arms, legs, things like that. It can also affect your spine, and it can lead to some spinal deformities. Okay, let's talk about bone tissue. Since we're talking about it breaking down and not being as effective as it once was, there's different types of bone. You've got compact and spongy bone. Compact is about 80% of the total skeletal mass, and what that means, it's compact. It's where all the cells are close together and hard, and we're talking about bones like the femur, tibia, humerus, radius, long bones. It's the outermost layer of all bones, and spongy bone makes up the remaining 20% of total skeletal mass. And we're talking about like the bones that are in the head, neck, and torso. These bones have relatively large spaces in it. It makes it more lightweight than compact bone is. Also a little more fragile than compact bone. There's a continual process of remodeling that happens with our bones. It happens because of osteoblasts and osteoclasts. Osteoblasts build bone. Osteoclasts break bone down. So when your osteoclasts are working faster than your osteoblasts, you're going to have a decrease in the amount of bone tissue. This remodeling is affected by hormones and also influenced by the amount of exercise you have, especially weight-bearing type exercise, and your dietary intake. Here are some hormones that influence your bone remodeling: estrogen and testosterone. human growth hormone, thyroxine, and calcitonin, and parathyroid hormones. This is a good one for you to look back over after this. I'm not going to sit and read it to you, but it tells you what each one of these hormones function is in relation to the influence they have on the remodeling of bones. As far as changes that happen anatomically and physiologically to our skeletal system, with aging, we're going to see the skeletal system start to have more bone and joint disorders, just from overuse, from age, from what we just talked about, osteoblast activity not being as fast as osteoclast activity. So one thing to remember, you need to know what osteoblasts are and osteoclasts. That will be tested on. Osteoblasts build bone, osteoclasts break down bone. Okay, so with that being said, when we're growing and we're children, during childhood and adolescence, osteoblast activity, or the building, is going to outpace the osteoclast activity. So you're building bone, they're getting longer, stronger, and denser because of that. That's during childhood, and we know during that point we're growing, so we need that, our osteoblasts, to win that war. In early adulthood, osteoblast and osteoclast activity are equal, so that's why we stay the same size and don't generally have any issues with our skeletal system for the most part. By the time you reach middle age, or actually closer to older in age, osteoclast activity starts to outpace osteoblast, so your bones start breaking down a little bit. Women start to lose bone mass earlier than men do, and they also lose bone mass at a much more rapid rate than men. So that's one thing for us men that we have in our favor. As far as aging, talking about our bone tissue, you're going to have a loss of bone mass. The intervertebral disc, the disc between your and your spinal column, those start to deteriorate. You also start seeing abnormal spinal curvatures. One is known as kyphosis. You may want to look that up in the book also. This is also referred to as being hunchback, which is an excessive thoracic curvature of the spine. Thoracic is kind of up here, shoulder blade area of the spine. It's common in elderly people, especially women. So know what kyphosis is. And here's a visual representation. And as you see here, that's the thoracic area right here where this abnormal curve starts to begin. As far as our joints, which are part of the skeletal system, the structure of the joint starts to deteriorate. Synovial fluid production decreases, and as we talked about before, that is going to cut down on the lubrication in the joints and make things move. You know, something with less lubrication is going to not move as easily as it would if it had normal production. Your tendons and ligaments are going to start to lose some strength and flexibility. You'll see some deterioration of cartilage, a decrease in range of motion, which is just the flexibility that's permitted by a joint. The one thing to note is that flexibility and stability are inversely related. So the more stable something is, generally, the less flexible it is. And the more flexible something is, the less stable it is. These are some things that affect the flexibility of a joint, the shape of the articulating surfaces. So if you've got two bones that fit closely together, like very close together, they're stable, but they're not very flexible because they don't have the ability to move that easily. Stability and tension in the associated ligaments, that is a factor as well. Two bones held together by tight ligaments are more stable but less flexible. If the ligaments are not super tight, then you're going to have a little more flexibility. Tension in surrounding muscles. We all know that We've had days when we've been sore. You feel like you've got less flexibility because you're sore. So muscle tension restricts flexibility as well. Joint use. The more a joint is used and moved through its full range of motion, the more mobile it remains. So if you don't use it, you lose it. That's kind of what this is getting to as far as flexibility. So as far as aging and joints, you're going to see changes. It's usually starting around age 40, sometimes sooner, depending on the lifestyle that you've lived and things like that. Also, with age, total water content in the body starts to diminish. What that ends up doing is it pulls some of the water out of your cartilage pads found in the intervertebral space there between the vertebrae and the spine. And that loss of fluid there, and therefore kind of crowding of the spine together, is going to decrease your flexibility in the spine, and eventually you'll see stiffening of the spine. I'm in my 40s and I'm starting to feel a little bit of this myself. Sprains, we need to know what sprains are. These occur when cartilage, tendons, or ligaments are overstretched. Symptoms are just going to be swelling, pain, reduced range of motion, and minor sprains require rest, ice, compression, and elevation. RICE, use that to remember that. Rest, ice, compression, elevation equals RICE. I think that will probably be on the test as well. More serious sprains are going to require medical attention, perhaps a cast or a boot, something along that line. Bursitis is inflammation of the bursa sacs that are associated with joints. It comes most of the time from the overuse of a joint. It responds to rest, ice, compression, and elevation as well. Some joints are going to be harder than others to elevate. Say it's your shoulder joint, how are you going to elevate that? But if it's your elbow, that can actually be elevated. Sometimes bursitis, to try to get rid of some of the symptoms, you have to have steroid injections. It's seen commonly in the shoulder, elbow, and the heel of seniors. Don't really think of a heel as being a joint so much, but it is. Arthritis, this is an inflammation of the joints, and the CDC says that 46.4 million Americans have doctor-diagnosed arthritis. There's a lot more that have it and have not been diagnosed. There's no cure for it. The main goal is just to manage the pain, reduce inflammation, and prevent further deterioration. There's over 100 forms of arthritis. There's really two that are the main ones are osteoarthritis and rheumatoid arthritis. Osteoarthritis is the most common type. It develops over time, and this is overuse arthritis is osteoarthritis. And you need to know the difference between osteoarthritis and rheumatoid arthritis. Osteoarthritis happens with time as they're repeatedly used. Your joints usually affect small joints. We're talking about in the fingers, the feet, the spine, as well as in sometimes your weight-bearing joints of the hips and knees. What you see is the articular cartilage at the end of the bones, which is the buffer between the bones, starts to wear away, and that's what starts to cause this. There's about 27 million people in the US alone that have osteoarthritis. And again, this is wear and tear or degenerative arthritis. Here is just the symptoms of osteoarthritis. I'm not going to read that to you either. You can look back at this. Some risk factors for osteoarthritis. Men over the age of 45 are at a greater risk. Women over the age of 55 are at a greater risk. Black men and women have a higher risk for osteoarthritis of the knee and hip. Those of Asian descent have a higher risk of osteoarthritis of the knee than do whites, but a lower risk of osteoarthritis of the hip, that's an interesting stat. Obesity is an obvious risk factor. Working conditions, people who have to kneel and squat a lot are going to be prone to osteoarthritis. People who have a family history are at an increased risk. If you've got anatomic abnormalities such as unequal leg length, things like that, or misaligned knees or feet, that's going to make your breakdown of your joints be more rapid than someone who has normal leg length or knees that are aligned. Places where you've had injuries, major injuries in the past, in their joints are going to have an increased risk for osteoarthritis in that joint as well. So that's something for me to look forward to, because I've had knee surgery on my right knee. So I assume that here before long, I'll probably have a little osteoarthritis to go along with it. Rheumatoid arthritis, on the other hand, this is an autoimmune disease. It affects 2 million people or so in the United States. Usually comes on between the ages of 40 and 60, not always, but usually. It develops as immune cells start to attack the synovial membrane, and we know that that membrane is what produces synovial fluid, makes our joints move easier. The symptoms of rheumatoid arthritis kind of come and go. There's an active phase and an inactive phase, and there can be multiple joints affected, unlike osteoarthritis, which is usually isolated to single locations or always stays in the same place. Rheumatoid arthritis, excuse me, can kind of affect multiple joints. So here's just a picture of spongy bone, which is up here at the neck of the femur. Now, you're going to have compact bone down here in the long straight portion, but up here in the neck, you've got spongy bone. So you've got a healthy bone here. The whiter portion is the bone, and the spaces here, these are supposed to be here in spongy bone. Below, you've got much larger spaces and much less bone. So that's osteoporotic spongy bone in the lower picture there. Here's how you see osteoporosis can affect the body through aging, and we actually have a decrease in height through time. Once you start to see this kyphosis, curvature in the spine, the head's going to be lowered. You will be shorter when you get to be older. Some precautions during exercise for people with skeletal issues. You want to stay away from high impact activities. That's kind of common sense. Stay away from explosive or twisting movements. A lot of people who have osteoporosis and arthritis and things like this are going to be elderly. So be aware of balance issues that someone may have. Take note of comorbidities, such as, high blood pressure and things like that. You want to avoid heavy weightlifting. Heavy weightlifting could be dangerous to bones that are already kind of fragile. As far as high impact activities, jogging and high impact aerobics, things like that are considered high impact activities, they stimulate bone growth. They're not recommended for this population because of the dangers that are associated. Weak or frail bones, they might actually break during minimal impact activities. So during high impact activities, you can only imagine what would happen to bones that are weak or frail. These high impact activities also tend to aggravate symptoms of arthritis and accelerate the progression of arthritis, which we don't want to be a part of leading to this happening. So we need to find a balance between intensity and the amount of impact that is there. When we're talking about explosive or twisting movements, they are going to significantly stress the skeletal system. That's how I hurt my knee, was I twisted my knee with my foot planted and pretty much blew my knee out. So I know from personal experience that explosive twisting movements can stress our skeletal system. The knee, hip, and shoulder joints are especially vulnerable. Those are joints that have a lot of they can move different directions, and it makes them vulnerable. Osteoporotic bone can actually fracture with abrupt direction changes or explosive movements even if someone doesn't fall. So sometimes there's cases where, say, someone breaks a hip and then falls, rather than falls and breaks their hip. That happens sometimes, and there's been some studies even done regarding that. Balance problems. A lot of people who have these bone and joint disorders have balance problems. Their muscles are often weak, and that leads to some of these balance issues. Also, as your posture changes, kyphosis we talked about already, that can lead to balance problems as well. You put your head out there forward. We all have our heads are pretty heavy, so that changes your center of gravity. You want to avoid free weights since they require more stability than machines. When we're talking about being aware of comorbidities, we're talking about the fact that people have other conditions that interfere with their ability to exercise. Some of these are going to be cigarette smoking, excessive alcohol use, people that are sedentary, or people who don't eat diets that are adequate for their bodies. Those are all risk factors that can hinder your ability to exercise. You have to kind of assess the risk factors, identify the chronic conditions that are going on before allowing your client to exercise and before being able to plan what you want to do with them. Avoid heavy weightlifting. These are things we're going through each one of these one at a time, but lifting heavy weights puts excessive stress on osteoporotic bone and arthritic joints. What this can do, it can cause further damage to the skeletal system that's already compromised. And some of the signs of overtraining are going to be excessive joint swelling, after exercise. That's going to be accompanied by decreased joint mobility. You're going to see increased weakness, persistent fatigue, prolonged pain following the exercise. If that's the case, you're overtraining. So we talked about all the things to watch for and the bad things. So what are the benefits that we can see out of exercise for people in this population? You see decreases in the rate of bone loss, increases in bone mass. People that are exercising also tend to maintain and even increase the function of their joints. Preservation and increase of muscle strength. Improvements in cardiorespiratory functioning, weight control, reduced pain from arthritis, and here's the one that's always there, improved mood. So remember that that's an important benefit from exercise for each of these populations, is the mood improvement you see after exercise. It decreases the rate of bone loss and increases bone mass. What's happening there is when bones are not challenged, your osteoblast activity tends to decrease. When bones are being subjected to mechanical stress, now keep in mind it needs to be the appropriate level, your osteoblast activity can pick back up and increase again, which can make your bones stronger. This occurs even in people who have osteoporosis. Regular activity prevents the risk of second fractures in those who've already had a fracture before. Weak bone, like healthy bone, responds to increased workloads. So places that you have injured in the past, exercise can help that from happening again. As far as joint function, combining cardiovascular and strength training, that's going to promote the synovial fluid production we talked about. It's going to help maintain and improve flexibility and help with balance issues that they may have. Some researchers have found that exercise doesn't improve joint functioning in those with arthritis. There's some that have found that it does, and some have found that it does not. Those in the studies where they say that it doesn't improve joint functioning, they basically say that they find no benefits to joints at all, but they do agree that exercise doesn't make existing arthritis symptoms any worse either. So the benefits you could see to your bones, overall, the benefits to the body will probably outweigh, even for these researchers, the fact that they may not find improvement in joints. Excuse me. Also, you see preservation and increase of muscle strength. When activity levels start to decline, your muscles start to atrophy or break down. Exercise can slow this down and slow the loss of strength by preserving your muscle mass. With age, you tend to just lose some muscle. Likely increases muscle mass and thus contributes to strength gains. More muscle, more strength. Those who are physically active likely have better stability and a better functional capacity. Cardiorespiratory functioning, you're going to see improvement there. Better coordination between the cardio system and the respiratory system. Exercisers will see lower blood pressure, lower blood cholesterol totals, lower triglycerides, higher red blood cell count, improved tidal volume, and improved maximal oxygen uptake. Those are all positives. All factors that reduce the heart's overall workload and the risk for conditions such as heart disease and stroke that we just named above. As far as weight control, keeping your body at a healthy weight, it's going to not only reduce the workload of your heart, but it lessens the burden on weight-bearing joints. So less weight on these joints is going to make your joints have less stress on them on a daily basis. Overweight individuals suffering from joint problems, they can improve their condition a lot by increasing their daily activity. So increased activity coupled with weight loss prevents further joint deterioration. It's going to cut down on pain, and you'll see improvements in range of motion around the joints that are targeted in the activity. As far as reducing pain from arthritis, exercise reduces the intensity and frequency of pain seen by people who have arthritis. It's the only non-pharmaceutical treatment shown to be effective against pain. It could be because continued use of a joint encourages blood flow to the area. Blood flow is a positive because it in turn promotes synovial fluid production. This synovial fluid, what it does, as said before, it reduces the friction between the ends of your bones and prevents the buildup of waste products. You don't want junk between your bones. Mood improvement. We know that exercise is associated with elevated mood in every population we've studied. The more consistent the exercise program is, the better and greater effect it has on mood. Exercise promotes chemicals in the brain that are associated with improvements in mood, and it seems to improve the mental and emotional well-being of all participants. So exercise testing for those with osteoporosis, the guidelines are the same as those for the general population. I'm going to have to pause for a second, guys. I'm trying to figure out how to do that. I'm going to stop share and I'll come right back here. All right, let's get back to it. My phone was going nuts and driving me insane. I had to see if there was something going on. Anyway, as far as exercise testing, if we're talking about people with osteoporosis, guidelines are the same as the general population. If somebody has severe osteoporosis in their spine, they should probably use a cycloergometer or a stationary bike rather than a treadmill if walking causes pain. People with severe kyphosis, they might experience reduced ventilatory capacity. If you're ventilatory capacity, if you are bent over forwards, you have a harder time taking a good breath. So that's kind of what's happening with kyphosis. That reduced ventilatory capacity that can hamper the results of the test. Avoid spinal flexion and stop exercise if pain develops. Things that people with osteoporosis should avoid: jumping, jogging, rowing machines, sit-ups, golfing, bowling, certain yoga poses. These all have abrupt changes of direction or put you in positions that are going to cause stress on your bones. That's the issue with which each of these. They all have different mechanisms of putting that stress, but they all stress the bones in different ways. And osteoporosis, we're talking about weakness of the bones. For people with arthritis, make sure that they have a proper warm-up before testing, exercise testing. Don't test when someone's during a big-time flare-up. They're not going to get good results. Be prepared to modify or stop testing if pain or fatigue develops. Treadmill testing is usually fine for those that can tolerate it. Usually a bike is less painful. Some sufferers, they can tolerate a 1 repetition max testing. As far as lifting weights, they might be limited by pain in the affected joints though, so that's going to affect the amount that would end up showing on the repetition max. As far as guidelines for people with arthritis, you want to include daily activities that focus on functional capacity, so everyday activities that they need to do. You want to cross train to avoid overstressing joints, avoid walking at really high speeds, give time to recover, so allow 48 hours in between training sessions, and they need to wear good shoes that absorb shock well. So here's some sample exercises for arthritis. Stretching exercises, they're the most important for preserving joint functioning. Traditional resistance exercises and cardiovascular training are appropriate as long as the guidelines mentioned earlier in our talk are followed. As far as nutrition, for people who have arthritis, there's not a lot of evidence that shows a relationship between diet and the development or the management of arthritis. Just a good balanced variable diet, which is appropriate for the regular population, is what's best for people with arthritis. Research that's been done has been more focused on diet with rheumatoid arthritis, and yet they've still shown very little evidence that what we eat has a lot to do with arthritis at all. As far as rheumatoid arthritis and diet, some more, you want to balance your energy intake with energy output. Take in X amount of calories, burn X amount of calories. Make sure to include plenty of fruits, vegetables, and whole grains. They have antioxidants that help fight inflammation, which is part of the symptoms with rheumatoid arthritis. You want to go with low fat, low saturated fat, and low cholesterol products. That helps to keep your blood lipid profile in the healthy range. Omega-3 fats also might be therapeutic. There have been things that show that omega-3 fats are good for joints. Consume moderate amounts of sugar, and if you drink alcohol, it needs to be in moderation, if at all. As far as people with osteoporosis, they need calcium and vitamin D big time in their diet. We're talking about bones, and those are some of the main things that you think of for as far as strengthening our bones. Potassium and magnesium, vitamin C, sodium plays a role, and proteins, carbohydrates, and fats. They have specific amounts that they need to have of each of those. Smoking is not beneficial for bone tissue either. Alcohol intake is not beneficial for bone tissue. There are some supplements that can be somewhat helpful, calcium supplements and things like that can help with bone tissue, but nothing is better than the things that we talked about that we could actually do through exercise. And I'll let you guys come back and read this summary. It's basically just a run through, but I think it would be good for you prior to the test to at least read through this summary portion. And I appreciate you being here. Hope you are doing well, and I will see you next time.